evening, Bahamas. Welcome to our Ministry of Health COVID-19 update. We welcome the media and we welcome all persons who are tuned in to get the latest update of our COVID-19 situation in the Bahamas. Today we have the Honorable Renwood Wells, Minister of Health, and we have the Most Honorable Hubert Minnis with us, and I will now ask Minister of Health to give brief remarks and introduce the Most Honorable Prime Minister.
Thank you. Good afternoon. On my appointment as Minister of Health, the Prime Minister set improving our healthcare infrastructure as one of my main mandates. Throughout this crisis, the Ministry of Health has worked to make improvements across our archipelago with the keen awareness that COVID-19 could emerge on any of our islands. During the pandemic's first wave, we were fortunate that there was limited spread across the country. Cases were limited to New Providence, Grand Bahama, Bimini, and Cat Key. In this second wave, there has emerged incidents on other islands. I must send this clear message to the people of all islands of the Bahamas, including our family islands, that were not affected during the first wave. This virus is very infectious. It could emerge on any of our inhabited islands or keys. It is critically important for our family island residents to keep discipline, as there was transit between islands and international visitors since our opening up. Cases can emerge in places spared during the past few months. The wise guidance of our healthcare team, the policies of the government, and the Bahamian people and residents following that guidance are what brought us through the first wave. To Bahamian and residents on New Providence, Grand Bahama, and our entire family of islands, please adhere to the advice. Keep physically distant when out on necessary trips. Remain at least 6 feet from others. Stay at home when you do not have to be out. Wear your masks when out. Be sure the mask covers your nose and mouth at all times. Wash or sanitize your hands frequently. Do not put your hands in your eyes, nose, or mouth. If you feel sick, call ahead to your healthcare provider, advising them of your symptoms before you go in. On New Providence, all of the primary healthcare facilities, inclusive of Elizabeth Estates, Flamingo Gardens, Fleming Street, Blue Hill Road, Adolescent Health Center, Anstown, Fox Hill, Gambier, and Adelaide's clinics have identified a space for the temporary isolation of patients suspected of COVID-19. Once the assessments are completed, the patient would be referred to South Beach Health Center, the Princess Margaret Hospital, or Doctors Hospital West, if necessary. In the various islands and keys of the family islands, our healthcare team has, in some instances, identified facilities for isolation and quarantine. In some locations, we are working to expand and improve facilities for the isolation and quarantine of cases as is necessary to meet the needs of the related community. Infrastructure work is needed at various sites. I have taken on the task of ensuring that whatever works are needed will be expedited in the shortest possible time. As our Chief Medical Officer and her team lead the medical response to this crisis, while working with them on those matters, I am leading an aggressive campaign to ensure all healthcare upgrades and infrastructural projects move forward immediately. Whatever decisions need to be made will be made. Money was allocated in the budget for works to be done. We will get those projects going to ensure the infrastructural needs of the Bahamian healthcare system are met in the shortest possible time. The work to strengthen the national health infrastructure, and especially that of the Family Islands, is of paramount concern to me. As the new minister, I want to say how impressed I am with the talent of this health team. The Bahamas has a well-educated and dedicated group of men and women at this ministry and its related healthcare facilities, agencies, and departments who work tirelessly day and night to protect public health and care for the sick. As these dedicated people work to keep us safe, we must work to keep them safe. If we slacken up and more virus spreads, more cases expose them to sickness in our healthcare facilities. We do not want this to happen. More illness among the healthcare team would put an exceptional strain on our system. And as we have seen from countries around the world, when healthcare systems are overwhelmed, unfortunately, deaths increase. COVID-19 has interrupted the normal way of life worldwide. There has been more than 630,000 deaths around the globe and 15.5 million infections. We will not return to a more normal way of life until there is a vaccine, and it is unclear when one will emerge. Countries are facing the same challenges of responding to upsurges in cases after opening up to allow commercial activity. We must be disciplined during this time and any future periods of virus resurgence. Our success during the first wave have resulted from you following the good advice of our public health team. Recommit to following that advice in its fullness. Encourage your family and friends to do the same. The more disciplined we are, the faster we will end this second wave. I now introduce to you the most honorable Prime Minister, who will update you further.
Thank you, Minister Wells. Ladies and gentlemen, health officials have made a series of recommendations to control and reduce the spread of COVID-19. These include a wide range of measures, including, but not limited to, the closure of domestic borders, discontinuing indoor and outdoor dining, restricting social gatherings, weekend lockdowns, and a full national lockdown. After such consideration, we have determined a way forward that takes into account the grave health crisis and the need to provide economic survival. Public health officials are closely monitoring indicators to determine whether more or less stringent measures will be required going forward. The major indicators include the increased number of cases, the increase in the number of hospitalizations, and the availability of ICU beds. Starting tonight at 10 p.m., a weekend lockdown will be implemented for all islands of the Bahamas, excluding Grand Bahama, who is currently under a national lockdown. Grocery stores pharmacies, gas stations will be allowed to operate for the public during this weekend lockdown from 7 a.m. to 6 p.m. During a lockdown, unless you are an identified essential worker, you may not leave your place of residence for any purpose other than to seek urgent medical care or to purchase food or medicine. You may exercise within your immediate property only. Essential workers will be permitted to provide critical services, including the National Food Distribution Task Force and other NGOs for food distribution purposes. We will remove weekend lockdowns and other restrictions on an island-by-island basis. To be clear, construction will be allowed to continue this weekend, including reconstruction on the island of Abaco and its keys. The transportation of inter-island freight may continue. Persons collecting freight must seek approval from the Royal Bahamas Police Force hotline on their respective islands. We anticipate more weekend lockdowns going forward until the health indicators suggest that it is safe to do otherwise. Effective Monday, the 27th of July 2020, commercial activity will continue as normal, except as follows. A new curfew from 7 p.m. to 5 a.m. will be implemented. Accordingly, all business activity must be completed by 6 p.m. Indoor and outdoor dining at all restaurants will be prohibited. Takeaway, curbside, and delivery services will continue to be permitted. All congregate activities will be prohibited, including in-person religious services, sporting events, group exercise, and all social gatherings. Funerals will be permitted at the graveside only, with a maximum number of 5 people, including officiant. Weddings will also be permitted with a maximum number of 5 people, including officiant. Regarding salons, barbershops, and spas, 1 client per service provider will be allowed in the building at a time. Gyms will not be allowed to operate. Beginning Tuesday, the 28th of July, at 7 p.m., inter-island travel will be discontinued. Before that time, all travelers returning to the Family Islands from New Providence or other infected islands will be required to quarantine for 14 days upon arrival. Ladies and gentlemen, we are fighting a battle on 2 fronts. All of us must hold the line together. The fight for the health and lives of our citizens comes first and foremost. At the same time, we are fighting on economic front for the financial security of every family. The reality is, we will rebuild our economy and we will recover fully. As a country, we must grow stronger together, protect each other, and hold out for us all. We will advance, but now we must hold a strong line and never retreat from fighting this disease. We think actions taken by the government have been constitutional and in the best interest of the Bahamians. We have exercised the lawful powers given under the Constitution and laws of the Bahamas. Ladies and gentlemen, early data indicate that of the Bahamians tested positive, a significant number had a travel history. We blame the problem we face on the virus. The virus disrupted our way of life and caused sickness and death. And it has done so around the world. It is up to us as citizens, government, and businesses to do all we can to minimize this spread. This is a fast-developing crisis. We make decisions multiple times a day to protect Bahamians. We learn from what we did right and wrong. And we learn what did not work. We pivot and subsequently change course. We will make the tough decisions necessary to protect Bahamians. We will put in place the best measures to protect Bahamians. And if they are not working, we will alter them to improve the situation. Ladies and gentlemen, I want to repeat, early data indicate that of the Bahamians tested, a significant number had a travel history. We must be responsible as individuals, but we also have a social responsibility to others. We should not allow the easing of various restrictions to lead us to do things we might regret and that might subsequently harm others. I want to make a very strong plea to Bahamians and residents considering or planning to travel overseas for non-essential travel, not to go overseas at this time. If you are thinking of traveling for non-essential or emergency reasons, please, I beg you, stay home at this time. I ask again, please stay home. Your travel to such hotspot areas can subsequently place your entire family and your nation in danger. A number of the cities and areas Bahamians and residents like to frequent in neighboring countries and cities are experiencing a dramatic rise in COVID-19 cases. Many of these are hotspots where this very contagious virus is widespread. If you travel to these areas and go to malls, go to shops, restaurants, or other establishments, you might catch this virus. You could subsequently bring the virus home and community spread could start all over again. Let me be as clear as I possibly can. Your actions can damage the health of others, and your actions could help worsen our economy, especially if we have to lock down again. A report on CNN today noted, and I quote, "Even countries lauded for their fast and effective responses to COVID-19 are seeing large outbreaks and resurgences of the infection, as it becomes clear that successes in containing the virus are often only temporary." end quote. This is why we are taking these measures today. My greatest duty is to save and to protect the Bahamian people. I continue to ask for your prayers, advice, and your cooperation. And let us pray together and ask for God's guidance. May God continue to bless each and every one of us, and may God continue to bless the Commonwealth of the Bahamas. I will now call our Chief Medical Officer, Dr. Pearl Macmillan, who will take us through our COVID position as we stand today and move forward.
Good afternoon again, Bahamas. Here is the latest update on COVID-19 in the Bahamas. The total confirmed cases of COVID-19 is now 316. Of that number, 124 are on the island of New Providence, 155 in Grand Bahama, 21 in Bimini, 6 in the Berry Islands, 4 in Cat Key, 2 in Cat Island, 3 in Moores Island, and 1 on Guana Key. There are 42 new confirmed cases of COVID-19 today. Deaths remain at 11. Hospitalized cases are at 11. A total of 3,907 tests have been completed thus far. Grand Bahama has become the hotspot, or the epicenter, for COVID-19 in the Bahamas. After having no cases for some 64 days, Grand Bahama has now exceeded New Providence in the number of confirmed cases. From the end of May 2020 to the first week of July, less than 4 new cases were reported, clearly indicating that community transmission had been suppressed and reliably demonstrating that collectively we had ridden out the first wave of COVID-19. First graph. This graph shows that in the first wave, the Bahamas recorded a total of 108 cases. These cases occurred across 4 islands: New Providence, Grand Bahama, Bimini, and Cat Island. From July 8, 2020, marked the beginning of our second wave, and you can see it on this graph where we started to increase in cases again. New Providence since then has seen a 45% increase in cases, from 82 to 119. Grand Bahama has seen a 119% increase in cases, from 10 to 120. Bimini, including Cat Key, has seen a 50% increase in cases, from 14 to 21. In just 3 weeks, COVID-19 has been introduced into virgin communities such as Cat Island, the Berry Islands, Moores Island, and Great Guana Key. During the first wave of COVID-19 outbreak in the Bahamas, the number of new cases doubled every week for the first 2 weeks. By the third doubling, we were up to 20 cases per week. But this did not occur until the 7th week of the outbreak, and this is clearly outlined in the graph. The number of new cases steadily decreased after the 7th week of the first wave, ultimately reaching 0 new cases during the 16th week. In comparison, which you see on the right-hand side of the graph, during the second wave, the number of new cases tripled every week for the first 3 weeks. The number of new cases in the third week is expected to increase as there remains 2 reporting days in the third week of the second wave, which we are in currently. Next slide. The Hill projection, which you are looking at, the curves of both New Providence and Grand Bahama show no evidence that the outbreak is being contained in the short term. As you can see, the exponential increase, and the cases are following an exponential increase. The fit of the Hill curve suggests that by tomorrow, July 25th, New Providence could have a total of 50 cases for that day. The cumulative number of cases in Grand Bahama is projected to exceed 140 cases per day if it remains unrestrained. While these are only projections, we must take it serious in that we utilize data from our past cases in order to project what could potentially happen if we do not put measures in place. The growth of the outbreak in Grand Bahama is concerning, and it requires a concerted and coordinated effort and action to contain what is happening. The next slide pretty much depicts where we came from the beginning of the epidemic and the outbreak in the country, and it shows the initial wave, what we did during the period when we had no cases, when we had put in place various measures, and what happened as we now go into the second wave. It is clear that we have a steeper uptick as we move into the second wave. Even at this point, it is recognized that the characteristics of the second wave are different. It is more widespread. It is affecting more persons under the age of 40. It shows a much faster increase in growth, initial growth, or a steeper curve, as you can see on the graph. Early growth rates can be a predictor of the subsequent epidemic size. So we're in our second wave, and we have an early steep curve. If measures are not put in place, that curve will predict that we will continue to move increasingly new cases, likely across many of our islands, and certainly in New Providence. This becomes significant in charting the way forward. The total number of new cases reported in a single day during the peak of the first wave was 6 cases, and that was on the 1st of April. This contrasts with the second wave. Just yesterday alone, the 23rd of July, 55 new cases were reported in a single day. This wave is different, and it warrants action. When we look at those curves and the steep increase in cases, we have to take into consideration our capacity, our hospitalization capacity. Health capacity for responding to COVID-19 takes into account many factors. The health workforce is one factor. Our health workforce continues to be the gatekeepers for our health delivery and the public health fight against COVID-19. Our response would be challenged without them. To them, I say, you are valued, and you are appreciated. We thank you for your service. Another factor is the health system capacity. In New Providence, there is a total of 30 COVID-19 beds. And while we are seeking to enhance that capacity, that is where we are currently. In Grand Bahama, there are 16 such beds. At present, there are 11 hospitalized COVID-19 patients. And Grand Bahama is fast approaching the bed capacity. Of note, during the first wave, the largest number of hospitalized patients at any given period or any given point in time was 9. 9 patients. We have exceeded that already. National outlets for real-time PCR testing has expanded since we moved into our second wave. We have at least 3 private sector facilities which can now provide real-time PCR testing. We are pleased to report that the RNA extractor has arrived in country for our National Reference Laboratory. This equipment reduces the processing time of samples and consequently the time for confirming whether a sample is positive or not. In response to the increasing demand for testing, the National Reference Laboratory has identified qualified and credentialed lab volunteers to support the extended hours of operation. In country currently, in the public sector, we have more than 12,000 swabs and tests. As we look at the situation across the island, certainly this graph speaks to where we are. In Grand Bahama, you can go back to the graph. If you look at the graph and the chart on the right-hand side, you see Grand Bahama has the lion's share of the new cases, followed by New Providence, and to a lesser extent, you have the smaller amounts on the other islands. You can move on. On Berry Island, we have 6 active cases. I just want to give you a kind of context as to what we are dealing with. Certainly on Berry Island, we have 6 active cases, that's confirmed cases. And we believe, based on our history taking, that 26 persons from Berry Island went into Moores Island on the July 10th holiday. And I'm sure they enjoyed themselves. But this is a result of, we believe, we were, in our contact tracing, we learned that there was, I would say, a socializing event where there was contact between persons from other islands that we know have multiple cases, i.e. Grand Bahama. So they went back home to Berry Island and began having symptoms, and we have 6 active cases. So movement across our islands, it has risk at this time, particularly out of islands that we know have active transmission. Next slide. Cat Island, we have 2 active cases. Both cases possibly linked to a national who traveled into the US and came back home. And from that, we have 17 contacts in quarantine, and certainly we have to monitor them, and should they become symptomatic, we have to manage those cases. We have to test and manage. Next. Moores Island, similar situation, 3 active cases, possible links to Grand Bahama again, as we're finding in our contact tracing. Next. And certainly we have New Providence, where we have 42 active cases now and 5 confirmed today. So this is just to pretty much quantify or give you a picture of what is happening across our islands. and we have to take it serious. We only have so much capacity as it relates to healthcare system, and the more active cases you have, the more likely the likelihood increases that we will have ill people. Once you're positive, you don't know if you're going to stay mild, you don't know if you're going to be moderate, you don't know if you're going to be severe. So we have to do what is required to decrease cases, to decrease the likelihood of people getting very ill. We can only, our health system capacity can only manage, we only have capacity to manage, as I said, so many beds, so we must put in place and we must adhere to the measures. So as we look at our current reality, it is important to be mindful of what is happening in our other countries very nearby. Travel to and from international COVID hotspots certainly should not occur. The inter-island or domestic movements throughout, we have to be mindful that COVID-19 moves with us. So if we move from an area where we have cases occurring into an area where there are no cases, we can introduce COVID-19 into virgin populations. The gravity of the day is unremarkable, and stakes are high. A single new COVID-19 case is too much. We've heard that one bad apple spoils the bunch. If one of us does that, if one of us does not follow the public health measures, then all of us suffer the consequences. And we can't just follow these measures when we are in a surge. It must become habit, like brushing our teeth. Every single time we step outside or are about in the community, we must wear our masks. Every single time, we must remind ourselves that life, i.e. your life, my life, our family's life, is more valuable than a night out enjoying ourselves at a party or a hangout. Every single day, and many times a day, we wash our hands for at least 20 seconds. Difficult? Not really. Life-saving? Yes. Until there is herd immunity or a vaccine, COVID-19 will continue to be with us. It will linger with us, requiring changes to our customary norms. But we must not grow weary in doing well. We will manage COVID-19 in our country. Now I invite Dr. Bartlett from Grand Bahama to provide a quick update regarding the situation in Grand Bahama, and then we will go to questions.
Good evening. Grand Bahama has quoted 155 cases. Our first case in Grand Bahama would have been on July the 6th. It was this 27-year-old male who was a known contact of two persons that would have returned from Fort Lauderdale. One of the persons who returned from Fort Lauderdale on June 30th would have become symptomatic on July 3rd. Of that grouping, we have in that single cluster some 12 persons that can be directly linked to that group. Of that grouping, we are testing contacts of contacts. The age range of the persons we now have in Grand Bahama is from at our very youngest 6 years, and our eldest person is age 84. Most of our persons, our patients, our positive cases, they are between the ages of 40 to 49. And right behind that grouping is the group of 30 to 39. So most of our cases are in the group of 40 to 49. The most common presenting symptoms we have in our grouping in Grand Bahama, they present with cough, cold, and flu-like symptoms. That is followed by fever, respiratory symptoms. They also have complained of muscle aches and headaches, and a small minority of the persons complain of uh, loss of taste and smell. The most common morbidity we've seen in our grouping so far is hypertension, followed by diabetes. We have had some patients who've had issues with obesity, and one of our patients would have had obstructive sleep apnea. As of July 23rd, we have done 518 swabs. Once a person has presented with symptoms or they're identified as a contact, they are swabbed. Okay. At this point in time, we are doing what is considered to be expanded swabbing. So we have targeted groups. We're tracing contacts of contacts. In some instances now, we're tracing contacts of contacts of contacts. We are not at this time doing mass screening. Group and the swabbings that we're doing are targeted in order to get an idea of what our burden of disease is in our community. As of July 23rd, we have some 422 persons who are in isolation. Also, as it relates to contact tracing, we have 230 persons we have in our listing, and that group is growing on a daily basis based on the amount of positive tests that we have. Of the 422 persons that we have in quarantine, 111 of them are home isolated. We have 9 in isolation at the government quarantine center, and we have some 20 persons who are quarantined at our government center. The hospital, at this point in time, we are now only housing 2 COVID-19 positive cases. We would have transferred one of our cases to the Doctors Hospital West in Nassau. As it relates to augmenting our capacity and contingency plans here in Grand Bahama, we are present looking at our alternate isolation facilities, and those areas or those isolation facilities that we have identified that does not have the correct negative pressure rooms, we are in the process now of trying to alleviate that issue. We are evaluating sites that we have in the community to offset or to decant some of the patients that we have at our isolation center in order to make way to accommodate for the COVID-19 patients that we anticipate because of the large numbers that we are having. Other than that, we have challenges that are being addressed with disease surveillance in the area of contact tracing. And we were very fortunate to have the assistance from Nassau, the Ministry of Health, in providing support here on the ground to help us with this activity. I'll leave and finish my update with a very short story. There was a gentleman, a 30-year-old gentleman, in one of the hospitals in the United States. He came into the hospital after attending a COVID-19 party. Now, COVID-19 party is those parties where they have persons who are positive going to the party. They don't adhere to social distancing. They don't wear their masks. He went along with somebody who tested positive with COVID-19, so he knowingly went to a COVID party. He ended up being hospitalized and he died. And just before he died, he stated to the nurse, "I wish I didn't believe this was a hoax. And I wish I had not gone to that party." His friend is alive, he is dead. If we continue to do the things that we're doing now, going out into the community and we're not wearing a mask, believing that it is a hoax, we may have that same outcome. And I'd like to remind persons listening now is that those numbers that we give, when we give these reports, they represent a human life. If you believe you're a hoax, stay at home, stay away from other persons. Those of you who are listening and those of you who hear the message that we are doing, we need your help. We need your cooperation, because this is not just the Ministry of Health, Ministry of Transport, or all the other agencies that are involved in this exercise. This is everybody's business. The virus does not discriminate. And just as that 30-year-old I just told you a story about, it might just be you, they're having the same outcome, and you might become one of the statistics on that wall that we always put up the dashboard that everybody anxiously looks at if we continue to do what we're doing. Thank you.
Thank you, Dr. Bartlett. We'll now take questions. Matthew Moxie.
This guy. Yes, good afternoon. My question is for the Prime Minister. My question to Prime Minister Minnis is, The decision to open up the borders to all international commercial carriers after you would have announced that it was closed, what was the reason for this? Was it pushback from the United States?
Mr. Moxie, can you hold that question? Would you like to go on to a second question in the meantime? Oh, hold a second. Okay. May you repeat your question, please?
Yes, the decision to open the borders to all international commercial carriers after government would have closed them was, and this is in the US now, was that because of pushback from the United States? What led to this decision today?
No, I think, thank you very much for the question, but I think the Attorney General sent out a statement responding to that. But what he basically pointed out is that we have international responsibility, and we had to adhere to the Chicago Convention with respect to aviation.
Perfect. And now with the new restrictions in place with the 14-day mandated quarantine, will this now overwhelm an already strained surveillance team? And my follow-up to that would be how many people are currently being monitored on the Hubcat app?
Okay, so we have Dr. Brennan. Certainly the surveillance team is severely stressed, but we have been moving forward positively with the Hubcat app, and we are going to give you the exact numbers that we have, and we anticipate that utilizing the app, we will be able to monitor many more persons in partnership with national security. Dr. Brennan?
Thank you for your question. At present, we have more than 820 persons that are currently being monitored in our contact tracing setup, and that includes our Hubcat system and our in-person setup, where we have individuals who are outside of our Hubcat system that are getting individualized follow-up and individualized visits from members of our surveillance team, our mobile assessment team, those who are in our quarantine facilities. They are constantly being monitored. So it is a group effort of multiple teams being able to monitor those who are either contacts of positive cases, those who may have been exposed because they are in jurisdictions where they have high levels of transmission of the disease in their communities. And so as they travel back to the Bahamas, then we have to take the opportunity to be able to put them into our contact tracing system, and we need to be able to monitor them. So those numbers do fluctuate. We get persons who are added each day and taken away each day. Currently today, like I said, we're about 820, but we do get up into the thousands, and we may go into a few hundred, but it is a constantly fluctuating number. But we know that it is an activity that requires manpower, it requires equipment and supplies, and it is something we are constantly looking to enhance, because as more people come back and as more cases arise, we have to enter more people into the system and monitor them closely. Thank you.
Jerome Sawyer.
Good afternoon, good evening at this time, sorry. This question is related to the Prime Minister. So in your remarks, you would have mentioned, and it's been reiterated by others, that a significant number of Bahamians who traveled have tested positive. Are you able to give us any empirical data so that we can begin to understand just how many of these new infections are directly related to Bahamians who traveled versus others who may have come into the country? The question, I guess, on the minds of many people is, how do we know what percentage of those individuals who are in the new infections would have traveled, and how would that have directly correlated to the quick spread through the community?
So certainly, Jerome, in Grand Bahama, we would have looked into the amount of persons who would have traveled, and we would have, I think it was 115 cases we had at the time. We looked to determine out of those 115 cases how many had a travel history. We had a slight challenge with going through the paperwork of the travel history, but we had 56 persons who had travel history information at that time, and 22 of those, which is about 40%, would have actually traveled. So we are looking across the information that we have. We are seeking to enhance the travel information and getting it from our contacts, and we're also upgrading our system to ensure that we get that information from persons. But pretty much in the Grand Bahama situation, our numbers suggest that we had about 40% of the cases at that time of the ones that we had the information for would have traveled.
Just have a follow-up. The others, are you able to say where the 60% came from? And you mentioned a slight challenge with their travel documents. Does that now indicate that we have a larger problem with people coming in who would have traveled, particularly those under the 72 hours?
Dr. Brennan, you want to take that one?
Sure. Thanks again. So I think we spend a good amount of time focusing on the issue of the exact travel history of an individual. But what we do realize at the same time is the person who actually travels only represents one part of this equation. Dr. Bartlett was giving us an illustrative story that goes along with this. We have a story in the Bahamas whereby we had two individuals, a mother and daughter pair, that traveled outside of the country into a country where there is known to be a high level of transmission. That pair traveled outside the country and returned into the country. They returned, and as Bahamian residents are able to do, they returned into country without necessarily having the appropriate testing that we would want to have done. But because they're Bahamian, we allowed them to come back into the country. They were asked and required to quarantine. Unfortunately, through contact tracing, we were able to find out from them that they had visitors to the house. They then went out into community as well. And when we were able to do swabbing within their contacts, we found at least 8 other people who had been in contact with them that ended up being positive cases as well. Those 8 other people had no travel history. So when you see it represented in our press release or you see it in our dashboard and it says that those people don't have a travel history, it really doesn't mean that their case isn't related to travel. What it means is they individually didn't travel. But we all know through our contact tracing mechanism is that they were in contact with someone who did travel. So we have a cluster of at least 10 people that was related to 2 people traveling, and it is all an issue of us being able to leave the country and return. And when we do return, we don't have the requisite testing, our testing is old, but we can't be denied entry into country. And unfortunately, what that does is it sets us up in a situation whereby we may be the vector for the infection. And as was being said earlier, the virus does not respect whether you were gone from the Bahamas for 24 hours, 48 hours, 72 hours, 4 months. If you get infected during that time period, you have the ability to bring it back home. You then spread it to those within your household, you spread it to those within your community, and they then spread it to others. So the initial case or the index case may be related to travel, and those others are not related, but unfortunately, it only mushrooms into a bigger and bigger problem for us here in the Bahamas. Thanks.
More on this second question as I'm about to ask, which is also related to testing. You would have mentioned the RNA extractor which has arrived and the 3 private facilities which are testing. I would like for someone please to speak to the increase in the level of testing. I mean, we've seen in the past few days the issues that have arisen with just getting numbers from the dashboard, which I think speaks to how overwhelmed the system may be. Dr. McMillan, I think you would have spoken to, someone would have spoken to the additional resources that are coming in terms of personnel, et cetera. As it stands now, as I understand it, the National Testing Laboratory is responsible for confirming all positives. Is that correct? And if that is the case, are we going to be able to continue to test at the numbers that we need to, considering now that we need to do more testing And what are those additional resources going to look like to be able to test? Because evidence shows that the more you test, the faster you're able to get the situation, under control. So where are we with the resources? And then now that we've decided to open borders of sorts, how is it going to be different this time around when people are coming in? I mean, when you just would have admitted that people came in, were supposed to have quarantined or isolated, and people were coming to see them. I mean, what's going to be different this time around?
Okay, so you've asked a number of questions in one. Certainly, as it relates to the National Reference Laboratory, early on, there was a requirement for the National Reference Lab to do verification if we had other laboratories in the country who were beginning to use real-time PCR testing in the country. We needed to ensure that in our community, in our country, and this is something that we do with every new technology that we use in the country, particularly in laboratories, we have to ensure that we validate the process and validate what is happening to ensure that when we give you a result, it is that. So early on, we did require that any lab who would actually begin the process of testing for the real-time PCR, we would use our national reference laboratory to confirm and validate the process. We have moved beyond that, certainly with labs such as Doctors Hospital Lab now, which is testing. We have gone through that process. We have other private sector laboratories that actually send their specimen to reference labs outside of the country. What we would have done, we would have had to increase our testing, of course, given what is happening in Grand Bahama. But that would reflect some of the increase in numbers that would have been on the dashboard. But we are also incorporating the numbers from all the laboratories in the country, because we need to have a national picture of what is actually going on in the country. So we would have gotten reports from labs such as Doctors Hospital and the numbers that they are testing, and they will be now incorporated in the numbers. So you would have seen a bump up in our numbers, in part because of both of those reasons. And we anticipate that going forward, we will, as we get other laboratories that are validated to perform real-time PCR testing, and possibly we move into other means of testing, our numbers will need to expand in order to be able to quantify what is actually happening in the country as it relates to COVID-19. So I hope that answered your question. As it relates to resources in the lab, we are enhancing our capacities, utilizing, as I said in the report, we are looking at persons to come in and assist in the National Reference Lab, as well as getting additional equipment to enhance our capacities. Amajal Knowles.
Good evening. The new Minister of Health touched on it briefly as far as the facilities and professionals available to Family Island cases, but can health officials elaborate a bit more as to the contingency plan if there's a mass outbreak or surge on one of the Family Islands that may not have as much access to healthcare facilities like islands such as New Providence?
Dr. Bartlett, would you? Dr. Jillian Bartlett will speak to that.
Good afternoon, Bahamas. Yes, the Family Islands. We have a robust local healthcare team in all of our Family Islands, equipped with nurses, physicians, and administrators, all who are well skilled to deal with anything that comes into our facilities. If there's an impending surge, we have our healthcare team on alert, knowing how to conduct quick, rapid assessments to pick up any signs and symptoms of COVID. These cases are quickly isolated or quarantined. If they should deteriorate, we also have in place a mobile access where these clients can be quickly airlifted from any of our family islands into New Providence for further medical management. So they do have access to medical care quick, and we are ready to respond and to get any deterioration of any cases out as quickly as possible to sustain life. Thank you.
And for my second question, can we get an update on the passengers from Grand Bahama that are quarantined at Breezes or were quarantined at Breezes earlier this week, as how many persons are currently at the resort and if any have tested positive or among recent cases?
Dr. Brennan, you want to speak to that?
So we have a number of protocols that are in place as it relates to quarantine. So we know that here in country, as we allow both Bahamian residents and visitors to come into country, that there is a severe need for us to make sure that we pay attention and track what the movements are of those individuals. We know it represents a significant risk, and we have to be able to keep our hands tied with this activity. And so what happened over the course of the past week is we had a slow trickle of individuals coming in. We were able to hold on to them and say we knew where they were going, evaluate their households, and then we were able to put them into our contact tracing application and keep it in place. Unfortunately, when our borders started to close, especially to domestic travel within the Bahamas, we had an influx of individuals who were starting to move, and we needed to be able to keep track of them without losing their movements especially within the island of New Providence. So when that occurred, we had those individuals come into the country. We had them quarantined at a facility so that we could make sure that where they were going to go, where they stated they were going to go, where they were staying, was able to be evaluated by our health team. We had a mobile assessment unit and our Hubcat team and our tracing team evaluate them, have interviews with them, evaluate some homes to make sure that when they went into the community, they were able to be quarantined in a safe location where even within the home facility they were going into, they were not going to necessarily expose anyone else. So it was a very involved activity. Unfortunately, with the large influx of persons, it was something that came upon us really quickly and we needed to mobilize quickly. But I think with the help of other agencies, including the National Emergency Management Agency, we had the Royal Bahamas Defense Force, we had social services and the like, they were able to help us to make sure we had a coordinated activity to get our arms around how big this would be. We were able to track people and then release them to either transit through our community here in New Providence or transit on to other islands, but we're able to keep track of them so that we know that if they are in our communities, we know who they are, we know where they are, and we can make sure that we're not spreading it outside of our tracking capabilities into our communities without necessarily the Ministry of Health being aware of those capacities. As we move forward, we're looking to engage the Ministry of National Security to be a part of this, and we're standing up an actual COVID enforcement unit in collaboration with the Ministry of Health and National Security to be able to make sure they're going into communities and enforcing the measures related to it. So not just the contact tracing part of it, but they'll be going out to businesses and the like and social events to make sure that people are doing the right thing as well. Unfortunately, we noticed, I think we do, when we went into Grand Bahama, we were able to do what was called a windshield survey, and we just go around and we see what's happening in our communities. The same thing happens here in Nassau, the same thing happens in our other family islands, and we can see that there are people who are out there not necessarily adhering to the same social distancing policies, the mask wearing policies, the sanitization policies, and we need to make sure that we not just ask that people do so, enforce it in our communications, but we also have a unit that is going to be out there making sure that we pay attention to people, and if need be, we have the sanctions to go along with it, so there's some teeth to the enforcement that goes along with it as well. Thanks.
Rashad Roll.
Yes, good day. I just want to go back to something Dr. Brennan said. He gave the example of the people who were told to quarantine, but they instead contributed to the spread of the virus by going into the community and having visitors over. And, you know, the Hubcat monitoring system, it was thought would put an end or fix a lot of the issues we initially had with quarantine, but this clearly shows there's still a lot of problems. So what are you going to do now? I mean, is it feasible or the correct policy to continue to not allow people to stay in a government designated facility when they're supposed to be quarantining?
Well, certainly the Hubcat monitoring system, any system is as good as, its full use. And certainly we introduced it and we utilized it. And as we are now moving into, having the need for more and more quarantine, we certainly health monitored the Hubcat. Every time we put somebody in the geofencing, we had health monitors. We are at the point now where we required additional capacity to do the monitoring. And certainly we have partnered with national security, and we anticipate that what is going to be put in place, and it's already started, will be what is required for the monitoring of persons in quarantine. Now, it won't necessarily fully remove the need for having a site where we may need to put persons who are just not able to quarantine at home. But we are managing that whole quarantine activity pretty much utilizing multiple mechanisms, including both mandatory or site where we can put you, and thus enhancing our capacity to do the monitoring through our Hubcat solution. Next question.
Yeah, the emergency powers order that came out on Wednesday said visitors who come on commercial flights and legal residents in Bahama quarantine in a government facility. But there's no requirement for people who come on chartered planes to quarantine in a government facility. Is this going to change when the new emergency order comes out? And if not, what justifies this difference in the requirement when, all of them pose a similar risk of spreading COVID-19?
Well, certainly, the most honorable Prime Minister.
Thank you, Rashad. No, there would be no discrimination. However, you would find that many individuals who may have come in to our country on private facility may have adequate facility that meet government standards, but they're still monitored via Hubcap and ensure that they adhere to our regulations.
Ava Turnquest.
Hi, good afternoon. I just like a clarification on Dr. Minnis's answer. Is it that we still require the 10-day negative test to come in? Is that what's being used for private charters? There was no mention of it in this latest orders on Wednesday. And this is just a follow-up, not my first question.
Yes, with charters, yes. Everyone entering the country still requires a negative COVID test. That has not changed.
Okay, sir. My next question, or my first question rather, is for you. In that order that was tabled on Wednesday, two-part question. When you made the announcement that there would be a commercial travel ban, it was a national statement. However, this order that was tabled, there was no sort of communication explaining it. I was wondering why, given it was a shift in the decision that was announced. But also in that order, there is a diplomatic exemption. Can you speak to why that's needed and how that's going to work?
No, as you know, we have international regulations, and we have international commitments also. There are such things as diplomatic corps, and there are certain benefits or certain things that are given to diplomatic corps, and that's standard internationally.
And for the okay, I understand. And so my second or follow-up question would be, the extension of the emergency orders up until September, can you speak to or provide the public with some explanation as to why you felt the need to go for 2 months rather than one? Is it just a matter of expediency? And also, can you speak to concerns that there's not enough communication from you on what's happening?
Let me answer the second question first. This entire COVID is run by the health professionals, and you'd note that they're answering most of your questions. Now, what was the first question again? About the September. We thought that was necessary because COVID is a new entity. We don't know exactly, we don't understand this disease fully well. It changes, people have different presentations. We may have no cases today, and suddenly we may have a flare-up tomorrow. We must be able to act very quickly. And if we don't have such facility, we may not necessarily need it, but if we did not have it, then we have to go back to Parliament, debate, and try to get it put in place or get it approved, while at the same time the disease entity is just raving through our society. So it's a matter of quick response, and you would know if you look throughout the world, you would recognize that there must be quick response in order to, and those who respond quickly and aggressively had better results as opposed to those who had delayed response and more non-aggressive approach.
Karen Ferguson.
Good afternoon.
Good afternoon.
During the early days of the Ministry of Health's presser, there was a map showing the hotspots for Grand Bahama and for New Providence. This afternoon, there was a map showing the entire island, but did not specify the hotspots. Is there any information on where these hotspots are for New Providence and in particularly Grand Bahama?
So certainly we continue to do our mapping, GIS mapping in partnership with BNGIS, Bingus. We're continuing to do our mapping, and we do have maps of where the hotspots are in Grand Bahama. In particular, we have focused more on Grand Bahama, and we will continue to map those in New Providence. The maps that you saw today, we didn't intend to show that mapping today. It was just to characterize the particular island. But we are continuing to map those, and we will be able to provide those to you.
Okay, thank you. And for my second question, if persons would like to be tested in Grand Bahama, are there any facilities that they can go to? Do we have a list of these facilities? And are the facilities meeting the standards of Ministry of Health with the testing that they're offering?
So we have our partner here with us, Doctors Hospital. Did you want to speak to that, Dr. Antonio? Antonio Colley.
Good evening. So in Grand Bahama, we at Doctors Hospital have partnered with the Lucayan Medical Center to provide testing for patients who would like to be tested through that facility. Those tests are sent to Nassau the same day, and we're able to facilitate testing and have those results out for the public health system, for the Department of Public Health within 24 hours. So in Grand Bahama, Lucayan Medical is the site presently for testing for patients who want to be tested for COVID-19 through Doctors Hospital Health Systems.
Tyler Simonet.
Yes, good afternoon all, and good afternoon Bahamas. When it comes to my first question, the weekend lockdown notice was sent around, I believe, 2 or 3 p.m. today. I'm not exactly sure of the time. That was a very short window that Bahamians were given. Was it not a concern that Bahamians would start to crowd the streets because of the short notice? Just as earlier this week when Grand Bahama's borders were closed, we had a huge influx of people trying to leave the island. So is there any concern that these orders are coming out and aren't giving Bahamians enough notice and causing a huge scrambling effect?
So, you want to speak? And I was going to ask.
No, the orders are sent out by us, and we look at, we analyze the situation, listen to the healthcare personnel, and sometimes you must respond very rapidly. Sometimes you may have 2-3 days. Our response, when we respond, we take into consideration saving lives. That is of utmost importance to us. And sometimes may be 3-4 days. Other times, one has to do it very quickly. But believe me, those responses are only with respect to saving lives and ensuring that we don't have our people not only become ill, exposed, and subsequently die, but it's essential that we minimize that impact as much as possible.
Thank you for that response. And before you go, my second question is still for the Prime Minister. Yesterday, Leader of the Opposition, Philip Davis, called on the government to accept full responsibility for the spike of COVID-19 cases, that the policies and the borders reopening was, and I quote, full of loopholes. Can I get a response to this? Who is to blame for the spike in cases, and who do you think or what should take responsibility for this spike?
Well, there's a spike of cases in Hong Kong, there's one in Singapore, there's a spike in Australia, there's a spike in the US. Are we responsible for that too? No. What happened is a spike in cases. Everybody is basically managing it as best they can. This is a new virus, a new disease, and things will change rapidly. There's no textbook I can read. There's no textbook the Leader of the Opposition can read. There's no textbook any leader can read. We're writing the textbook as we go along. If he can do it better, ask him to kindly bring me the textbook. I would be more than happy to read it. Thank you.
Elizabeth Bryan.
Oh yes, good afternoon, Dr. McMillan.
Good afternoon.
My first question, is there a plan in place to test a broader set of high-risk groups like frontline or essential workers, airport personnel and the like in Eleuthera or any of the other family islands to mitigate against the current risks of clusters and trends of community spread like we've seen in some of the major islands?
So certainly our testing strategy has we test symptomatic persons, we test contacts, and in the Grand Bahama situation, we went contacts of contacts, and as Dr. Bartlett would have suggested, contacts of contacts of contacts. I wouldn't say indiscriminate, but just testing, there is no real benefit to just testing. Testing must actually follow a particular reasoning behind it. There must be a strategy, and certainly we test to determine whether or not we have a case if somebody has symptoms, and certainly if somebody would have been exposed, and certainly in our healthcare workers, we have done when we needed to, when we had possible exposures in the healthcare environment, we did extensive testing. But to go into Eleuthera and just start testing because we want to find out whether or not we have the virus there. There is no real science behind that kind of testing. And certainly when we do test, most importantly is if we test a contact, and once we get a case, test their contacts, it's very important that they are actually quarantined and the case put in isolation, because we are seeking to prevent spread of this virus. So to your question, we are doing testing in vulnerable populations, and we are doing testing of persons who are symptomatic, their contacts, and in instances when required, we move beyond that testing strategy.
The answer to that question, Dr. McMillan. So my second question is, was there an error made in the assessment of potential sources of risk for the spread of COVID-19 in the Bahamas? Or was it the population who did not adequately heed what were appropriate health measures and policies? And what steps will be taken to ensure this rapid spread in the country does not take place when restrictions are eased in the future?
Okay, so a number of questions. Certainly, when you ask about an error made in assessment of risk, I think communicating the risk associated with how the virus is spread, we have made many efforts to do that. As it relates to, whether or not we will put in place measures, the most important measures are pretty well known already, and we are encouraging persons to engage in the behaviors that decrease the risk of spread of the virus. We have Dr. Nakia Forbes here with us, our infectious disease specialist. We'll ask her to speak a little bit more regarding the potential for spread and some of the measures that we can put in place based on risk that we already know.
Good afternoon, everyone. Thank you, CMO, for asking me to answer that question. It's a very important question because shall we stay locked down forever with no travel? That's the question. It's not feasible. So I can say to you that there are several parameters that can help to guide how you can mitigate the risk associated with travel. And we know that our spike in cases is related to travel. One, it has to be the right time. That means you have to have control of your epidemic in country. And the number of cases must be few. Certainly, we didn't meet that criteria. Your system has to be able to support travel. You have to be able to get testing for persons that may be coming back home or visiting. You have to be able to follow these persons, and if they need to be in quarantine, then you have to be able to enforce those quarantine rules or instructions. And you have to also be willing to adapt that. And so if you need to test those persons afterward and you determine that they are indeed positive, you've got to be able to quickly isolate them and do contact tracing. I'll say to you that we were able to detect that we were indeed having positive COVID-19 persons related to the travel, and they have been put into isolation. And lastly, there's not lastly, there are two other points that visitors have to be adherent to the guidelines in country. They have got to follow the mask policies, the crowding to avoid closed spaces, for example, and not to be understated, your population has also got to be able to follow those instructions. And so if there's a weakness in any one of those parts, and we've heard plenty feedback in the press conference already about what some of those gaps may be, you will have a problem. There will be no 100% bulletproof strategy if there's a weakness in any one of those things. We will have to re-examine this at a later time unless we plan not to have any kind of travel forever. Thank you.
Jasper Ward.
Good evening. My first question is for the competent authority, Mr. Prime Minister. Is he still there?
He's here. Go ahead.
Awesome. That question is, can you explain why international travel is still allowed to the Bahamas, yet domestic travel is now being prohibited? And also, why do islands that have no COVID cases have to go into lockdown if inter-island travel is being prohibited?
Why islands are being locked down? Is that the question?
No, there was a two-part question. The first part of the question was, why is international travel allowed, but domestic travel is now being prohibited? And the second part of the question was, if inter-island travel is banned, why do the islands with no COVID cases have to go into lockdown?
Yeah, good question, Jasper. Those travelers coming from abroad, there are very strict regulations. You're talking about just private jets, yachts, etc. They are very closely monitored. They must have COVID negative tests, and therefore they're very closely monitored. With respect to the family islands, once individuals move into one family island, they can move to 3, 4 different family islands quite easily. and we may lose them through the system in terms of monitoring. And your second question was?
The second part of the question was if inter-island travel is banned, why do islands with no COVID cases have to go on lockdown?
No, what happened is that is to protect them. What you will find is that with time we would ease those restrictions on those given family islands. The islands you'd be talking about in particular are those that don't have, at this particular time, that's Inagua, Mego, and Auckland's Crooked Islands, and Salvador is not recorded, and Long Island. And we would continue to monitor those islands and release restrictions with time. At the same time, we would encourage those individuals to discourage individuals from visiting their islands, and if anyone visit their islands, they should essentially monitor them and have them, force them into some form of quarantine, and don't necessarily commingle too closely with those individuals for at least about 14 days.
My second question, for the health officials, once again, a two-part question. The first part of the question is, any of the, 200, I'm not sure how many cases we now have since July 8th, but can you say if any of those individuals who would have recently tested positive came into contact with tourists or any visitors that would have come following our reopening of the borders? And the second question is, can you explain the recent errors, glitches that have been happening with the dashboard and information coming out from health officials?
So to the question regarding tourism or contact with a tourist, certainly to my recollection, that has not been found out in our contact tracing. That does not mean that there was not contact. Once we have a case, you know, we try our best to get every contact of that case, but somebody may not even know how and when they were exposed. So the second question was the glitches as it relates to the dashboard. Yeah, we have had a couple glitches as it relates to the dashboard. That activity requires that the testing results come out at a particular time. They get into the surveillance unit. We are able to actually, you know, go through all of what comes through the surveillance unit as it relates to numbers, and we, you know, then put it out on the dashboard. And certainly as the volume increased with testing and, you know, the capacities, we did fall behind to some extent, but we are steadily strengthening our capacities to be able to, you know, manage the volume at the lab so that we will actually be able to have our results out in a timely manner, and those results coming in from other labs. We have enhanced our system as it relates to the reporting of results. We have a cutoff time, and once what is in at that cutoff time is what we will move forward with, reporting on our dashboard. So we have had a number of glitches over the last few days, but we anticipate that going forward, we will be on point with our reporting. Samantha Lightbourne?
That's Marco Lightbourne for the Blaze 98.3 FM.
My apologies, Shamarco. My apologies, go ahead.
Greetings, Dr. McMillan, and congrats on picking up the mantle and leading the COVID-19 task force. My first question, in covering the reopening of international commercial flights about 3 weeks ago in Exuma, there were no Ministry of Health officials present at the airport to monitor protocols, which seemed like it would have been appropriate and necessary. Is this something that the ministry intends to do on family islands, the whole country really, now that we are reopening? I would ask the local ministry, but I am constantly referred to the administrator's office. Unfortunately, Exuma's administrator's office is temporarily closed due to all the staff members being quarantined, as one employee presented with a high fever.
So, Dr. Bartlett, I would ask you to respond. She will be able to give you a clear idea of how our healthcare providers on each island actually work closely with the wider administrative team on the island in order to monitor. Dr. Bartlett?
Good afternoon once again. I sort of remember that question from last week, but I will do my best to answer that again. Okay, health professionals and the health team, you have to remember our tasks are multi. And while we may not have been physically present at the airport, we are ever present, probably at the clinic conducting our services and trying to save lives. But we do partner with the immigration, local family island administrator, and all the customs and all the government agencies work closely together. So while we may not physically be present, health is always present. If there's any health-related questions, it's directed to the health team, and we do our best to respond in a timely manner. So while we cannot physically be there, we are present on those islands. The second question was, I didn't get the second question. Yeah, I don't know if there was one.
Okay, you have a second question?
Oh, yes, Dr. McMillan. So my second question is for preferably the Minister of Health, if possible. I've asked this question previously in a conference, and now the scenario has unfortunately played out. I asked, should patients on the family islands need to be flown out due to contracting the COVID-19 virus or are suspected of having it and require an emergency flight, would that expense be covered if the person is unable to pay, considering the economic constraints? A resident of Bimini reported being transported to New Providence during the lockdown on that island, and he was barely coherent and was made to sign a bill of about $7,800. At the time, there was no inter-island travel at the time. He ultimately turned out to have pneumonia. People on the family islands especially have this concern now as we go on to lockdown. What is the government's clear directive concerning this specifically, considering the economic climate? Is the travel covered, or are we receiving IOUs?
Thank you for the question. The government of the Bahamas has contracted air ambulance to deliver that service for and on behalf of the Bahamian people. And all of those persons within the family of islands who may be presenting with any sort of medical situation, air ambulance is there to airlift them here to New Providence so that they can receive the requisite medical care and attention.
So thank you. That ends our update, and have a good evening.